Welcome to Study Nurse IQ. I'm Jeannie. Today we're diving into IV needle gauges, their uses, and the all-important color codes. This is essential knowledge for every nurse. Let's get started. What are IV gauges? An IV gauge refers to the thickness or diameter of the needle and cannula. The needle is what helps us access the vein, and the cannula is the flexible plastic tube that stays in the vein to deliver fluids, medications, and blood directly into the patient's bloodstream. Here's the most important rule to remember about gauges. The lower the number, the bigger the needle. For example, a 14 gauge is much larger than a 24 gauge. You wouldn't want to give a patient blood through a tiny 24 gauge cannula because the small size can damage the red blood cells, making the transfusion ineffective. Gauges, colors, and uses. Most manufacturers follow a standard color-coded system, so once you learn them, you'll be able to identify the gauge just by looking at the color. Now let's talk about the different IV needle gauges, their color codes, and when you would use each one. First up is the 14 gauge orange. It has a flow rate of approximately 240 millis per minute. We use this very large size in emergency and trauma situations where you need to administer a high volume of fluids or blood very quickly. Next, let's look at the 16 gauge, which is color gray. It has a flow rate of approximately 180 milliliters per minute. This is a large gauge used for rapid fluid and blood administration, often in surgery, trauma, and ICU settings. Next, we have the 18 gauge, color is green. It has a flow rate of approximately 90 millis per minute. This is a great size for giving blood transfusions and for rapid fluid delivery. Some special procedures, like a CT with PE protocol, may require an 18 gauge in the antecubital area. Next, we have the 20 gauge. It is pink in color. It has a flow rate of approximately 60 milliliters per minute. Use. This is a very common size use for administering IV fluids and medications. Some hospital protocols may even allow for blood transfusions through a 20 gauge. Next is the 22 gauge. It's blue in color. It has a flow rate of approximately 36 milliliters per minute. Use. This is a smaller size, perfect for IV fluids and medications, especially in patients with smaller or fragile veins like elderly patients. Next is the 24 gauge, yellow in color. It has a flow rate of approximately 20 milliliters per minute. Use. This is ideal for pediatric and elderly patients with very fragile veins. It's used for slow fluid administration. Next, we have the 26 gauge, purple in color. It has a flow rate of approximately 13 milliliters per minute. Use. This is the smallest gauge, used exclusively for neonates and very young pediatric patients with tiny, delicate veins. So remember, the smaller the gauge number, the bigger the needle, and each size has a very specific use. Now let's test your knowledge with some NCLEX-style practice question. Question 1. A physician orders a blood transfusion for a patient who has been anemic. The nurse should select an IV catheter with which gauge to ensure the safe administration of blood. 24 gauge, 20 gauge, C gauge, 6 gauge. The correct answer is C, 18 gauge. Rationale. The 18 gauge catheter is an ideal size for blood transfusions because its larger diameter prevents the lysis breaking up of red blood cells. While some hospitals may allow a 20 gauge, the 18 gauge is the most appropriate choice for optimal infusion and patient safety. Question 2. The nurse is preparing to insert an IV on an elderly patient with very fragile small veins. Which IV gauge and color would be the most appropriate choice for this patient? 20 gauge pink, 16 gauge gray, C 24 gauge yellow, D 14 gauge orange. The correct answer is C, 24 gauge yellow. Rationale. The 24 gauge catheter is a smaller size, making it suitable for patients with fragile veins, such as the elderly population. It minimizes the risk of vein damage and is appropriate for the slow administration of fluids or medications. Question 3. During a mass casualty incident, a trauma patient requires rapid fluid resuscitation. The nurse should prioritize using an IV catheter with which of the following characteristics? A 22 gauge for easy insertion. B 24 gauge to reduce pain. C a small diameter to prevent extravasation. D, a large diameter to allow for a high flow rate. The correct answer is D, a large diameter to allow for a high flow rate. Rationale. In a trauma situation requiring rapid fluid resuscitation, the priority is a large bore IV catheter, like a 14 or 16 gauge. A larger diameter is needed to achieve a high flow rate, which is critical for quickly stabilizing the patient. Thanks for watching Study Nurse IQ. Follow us on YouTube at Study Nurse IQ, Nursing Made Simple.